Hey guys, Tony Palumbo here with Filter, and today I'm interviewing Chalmes Tarry of Healthcare All Year. Thanks for being on the call today, Chalmes.
Thanks for the invite. Really appreciate it.
Awesome. So we're here today to discuss healthcare and how it pertains to the healthcare marketplace. So we're going to discuss a little bit about what Chalmes offers for clients, and I'm just going to ask you a few questions. So, healthcare marketplace is still a myth for me. Like a lot of people don't know everything or understand everything about it, whether they qualify, don't qualify. Why should a family use an agent like yourself to enroll in healthcare.gov or purchase a plan on the marketplace?
That's a good question, Tony, because a lot of people feel that it's so easy that they can just do it themselves. And in a way, you could go on the marketplace and punch in information and do it yourself, but it may be wrong. Answer one question wrong, and you won't get any tax credits. That's help that you can get to pay for your premiums. And that's just one reason. Another reason is the marketplace sometimes asks for information. So now you have to upload documents. You got to make sure they go to the right place. And then sometimes you don't like the answer the marketplace give you. So an agent can help you do an appeal. So we can appeal that situation and then overturn it in your favor. There's just so many things that an agent can do that, normal person just wouldn't know. That anybody can go in and just join a plan. But when things go wrong, you're going to wish you had an agent by your side.
Chalmers, so I have a question. Do I have to have a job to get marketplace healthcare coverage?
That's a tricky question, Tony, because you may not have a job, but you need to be in between jobs, really. You need to probably be on unemployment, seeking a job. Then you can get some marketplace insurance. In fact, with the new changes they have right now, if you have unemployment, there's a zero premium plan out there just for those who are on unemployment. So yes, you could not have a job and still get health insurance on the marketplace.
Oh, that's great. And what are some of the myths about the marketplace? Because there's a lot of misinformation out there. And can you touch on that just a little bit?
I'm glad you asked that question because a lot of people think that it's a place where those who are on Medicaid or those who are on welfare go to get the health insurance, which is not the case. It's for working people. In fact, you have to hit a minimum of income in order to get on to the marketplace and get some insurance. So we like to encourage all working people. That's what it's for. All working people to at least find out what they qualify for and what they're entitled to.
Okay. And since you mentioned working people, I know that there's tax credits involved with healthcare on the marketplace. Can you explain a little bit about the tax credits and how those apply?
Yeah. Every person within a certain income get what they call tax credits, and they apply those tax credits to the premium. So what happens is if your premium is $900, just using that as an example, then your tax credit could be $850 a month. So all you would pay is $50 a month. And
Wow,
so
that's huge.
those tax credits go a long ways. And like I said, it's not welfare, but it's something that you put into the system. And you're just getting it back.
That's great. And can a person get insurance like after open enrollment, or are they tied to just that special, a one-time enrollment that they do every year that we hear so much about on the radio and television?
You want to get in November 1st to December 15th. You really do. But outside of that, you do have what they call special election periods that you can get in. Maybe you got married, you had a baby, things of that sort. So you can get in, but you really want to try to get in during open enrollment.
Okay, great. And then also, if I'm offered health insurance through my job, am I still eligible to purchase or obtain some health insurance from the marketplace?
The rule is this: if you pay more than 9.83% of your income towards your insurance at your job, then they allow you to go out to the marketplace and find something more affordable. So you can they could offer you job insurance, but if it's deemed too much, then you can go to the marketplace and get a plan with some tax credits and get help.
Okay. And then to get those tax credit, I know we have to report our income. Now, how does someone go about doing that? Is it last year's income? Is it this year's income? And how do they know what to put down in their application or to let you know what they make?
Yeah, that tricks a lot of people when they get out there on the marketplace and try to do it themselves. But really, they're looking at the next year's income, your present year income. So you have to guesstimate, estimate what your income will be. And you'll never get it perfect. But what we do is we try to tell our clients around June to report back to us and let us know whatever figure they gave us, they're on target to hit it. If they're not, then we can do what they call a life change, make the adjustment. And then at the end of the year, the tax credit will line up with their income. If it doesn't, and they get more tax credit than they're supposed to, then you have to pay some of it back. You don't want that to happen.
Oh no, that wouldn't be a good thing. And then for the people that do make too much and they don't qualify to get the tax credit, are there options for them?
Yes, some go off market and they get what they call short-term plans. Some short-term plans go out 3 years. Also indemnity plans, they're entitled to, but just keep in mind, when you go off marketplace, you do have to go through underwriting. So it's a little different than the marketplace where they ask you no health question. And so, but some people are young, healthy, and they prefer not paying for maternity and mental health and things like that if they don't have the problem. So they don't mind paying less that way.
Gotcha. And then talking about coverages, does the marketplace health insurance cover things like dental and vision?
It does for pediatric, those up to the age of 19, they will get dental, vision. But for adults, no. There is one plan out there that do offer vision and dental. It's not the greatest, but they can say they offer it. But the marketplace, that's not a requirement for adult to get dental and vision.
And then for the children that do get health insurance through their parents' plan, how long can they remain on their child on their parents' health insurance plan?
Now they can go all the way up to their 26th birthday. Then they have to get something on their own.
That actually gives them a lot of time to be on the parents' plan, to get them through college and
That's
help
right.
them to get started. Then, if someone has questions, how would they contact you? What's the best way to reach out to Chalmes Terry at Healthcare All Year?
The best way is the local number 704 595 7729. That's 704 595 7729. And we're in 7 different states. So you can call that number and you'll get us. Also, you can call the 800 number 1-800 634 6669, 1-800 634 6669, and we'll take care of you.
That's great. You guys help people over the phone so that we don't even have to come into the office.
Yeah.
We can just reach right out to you and you can help enroll and select plans and everything.
Yes.
So that's great. If you guys are on the fence and you're considering health insurance, I really encourage you to reach out to a knowledgeable agent like Chalmes Terry of Healthcare All Year because they really know their stuff. I cannot speak more highly of them. They're amazing. The whole team's amazing. Give them a call today. If you have any questions on how to contact them, there's also going to be a link in the description below. So you can click there and reach out to them. And Chalmes, thank you.
One more thing too, Tony, if I can mention, I want to encourage, like you said, to reach out to an agent, and just for a few reasons is because if you go to the marketplace and you try to fill out the application yourself, you answer one question wrong, you won't get those tax credits we were talking about. We don't want that to happen. And
Oh, no.
also, yeah, and you may have to sometimes supply information to the marketplace. If you don't know how to do that, how to upload that paperwork, that can cause you your tax credit. Also, if you don't like what they said, maybe they say you don't qualify, but you can actually appeal to qualify, and an agent will help you do that appeal and make sure you get your tax credit. So that's my advice. We don't charge anything. The insurance companies, pay us to help you. So keep that in mind.
Get your tax credits, y'all, if you qualify. So reach out to Chalmes and find out if you qualify and how much it is. and he'll be able to help you out. There's going to be a link in the description below again. So just click that link and you'll be able to contact him directly. Until the next video, you guys take care. God bless. Thank you again, Chalmes Terry, and we will talk to you soon.